welcome back. And we are moving into our final segment for today as we find out more about the upcoming Ride Across Belize and the Belize Kidney Association, which is one of the recipients this year. So we have at the sunset, we have Genevieve Nicholas, who is the Vice President for the Belize Kidney Association. In the middle, we have Chandra Cansino, who's the General Manager for Corporate Customer Relations Services at the Social Security Board. Yes. And on the end, we have Ruby Nicholas, who's the Treasurer of the Belize Kidney Association. Good morning and welcome, and thank you for being here.
Good morning.
Good morning.
Yes. So let's jump in first to just find out how Ride Across Belize decided to work along, or why you decided to work along with the Kidney Association.
Okay, this year we told our entire, as you know, the Ride Across Belize is a staff initiative of the
Yes.
Social Security Board that is supported by the board itself. This year we polled the entire staff through a little survey and asked them what they thought. One of the questions were, what do you think the Ride Across Belize, who do you think the recipients should be this year? And we received a lot of feedback from the staff, and one of the resounding responses were patients who need dialysis treatment. It is it's hitting home for a lot more people than we realize. Yeah. And we had a lot of people asking that to support that. So we reached out to the Kidney Association. We had some preliminary discussions with the ministry as well. We cannot choose that. We don't have the expertise and the criteria to choose who those patients are. Yeah. The Kidney Association is very well organized in their assistance, the assistance that they give to the public, not only for persons on dialysis, but also persons receiving treatment for kidney disease and prevention as well.
Education on prevention.
Yes.
Yeah.
So we decided we'll.
So the staff actually decided they wanted to help.
Yes, that's one of the more common responses. They had a variety of other suggestions, but the dialysis patients were one of the most popular ones.
You know what you're saying, Chandra, I think hits the nail on the head. It means that it has become a relevant issue to more people. And I think no one can speak to that more than other than a dialysis nurse, is the Kidney Association. And so, ladies, tell us, what are you facing in terms of responding to the needs of persons who have whether acute or chronic renal issues?
We want to take this opportunity this morning to truly thank Social Security Board. And it's not only for the assistance that they have provided us in choosing our organization, but they have also assisted us throughout the years in assisting in providing support for dialysis for patients, as well as support and financial assistance. So we were very elated to have been chosen, because every year they choose an organization. Yeah. But speaking about the fact that chronic renal failure has really been on the rise, we have several cases that warms our heart. As present as now, we have a 23-month-old baby with nephrotic syndrome that needs dialysis. And we are finding out that even children are now having kidney disease.
Can we treat that in Belize? Because it's a pediatric case.
Yeah. Yes.
That's the situation right now. As Ruby mentioned, we have a 12-year-old who also passed away on Saturday. Because they have the kidney renal failure. She came from Dangriga. And we don't have any pediatric nephrology in Belize. And so treating this 23-month-old baby is a challenge for us. We have contacted some pediatrician, the nephrologist here in Belize at Kartushna, and they're now working on that. That particular baby might be taking peritoneal dialysis soon.
Okay.
Yeah, but as what Ruby says, it's every week. Every week a new patient is coming to our clinic our association asking for assistance.
How do you can't help everybody. It's so expensive. We keep on saying this on the show, you know,
Yeah,
you
it
wanna
is.
you wanna
Yes.
have healthy kidneys because dialysis
Yeah.
is expensive.
So we have done several like aspect of what needs to be done.
yeah.
We recognize one preventative care.
Yeah.
So we have embarked on that. Well, we have been doing that, but we recognize that that is so essential for us to embark on because it's unsustainable for us to deal with patients who are now being diagnosed with kidney failure. So we want to start at the beginning with healthy eating. Those who have who are diabetic hypertension they need to now have a better control of that disease. We are finding out that those who are diabetic are more prone to kidney failure more than those who are hypertensive.
Yeah.
It doesn't mean that you're eliminated, but
Just
those
the
who are
risks are higher.
diabetic, the risk is even higher. So it's not an easy journey, but what we do, we try to do with one, the preventative care. Secondly, if you are newly diagnosed with kidney failure, we try to work along with you. The most we can do is to provide you with 2 or 3 dialysis as a newly diagnosed patient, because we have other patients who are coming behind. Now we have cases where they come to you, I'm sorry, I know we have gotten the treatment already, but can you provide us with treatment again? And so that's the reason why we find that organizations like Social Security and other organizations that we repeatedly knock on their door and supports us,
Yeah.
it goes a long way because it's hard for us to play the choice of saying,
Who
we
needs it
can't
more?
help you today. Some of them would have to tell them, can you wait on us until we raise more additional funding for us to provide that support for you?
Oh, I'm sitting here getting a little bit depressed. But first of all, what motivates? How do you not get frustrated? And when you're going through your thought processes, I know the human aspect of it must touch you.
Yes, it does.
A baby,
A 12-year-old passing away.
and you see death repeatedly. Is there any point in time when you start looking maybe to God or looking to the people themselves and say, maybe some of this is, you can help yourself? How do you not get frustrated and not start to lash out at anybody? People are supposed to help, maybe the medical people, maybe the government, maybe the patient themselves. How do you not get overwhelmed? I'm sitting here listening and I'm moved.
It has had its emotional toll on the association. That's a given. But we keep on saying that it's not about bringing in our emotions to the point that we want to give up. It's a matter of, as a team, we're constantly meeting, we're constantly trying to figure out how to raise funds. We're constantly saying to the different dialysis unit, help us here and we will do this, and we have organizations that we can say, come to you, help us, help us. So it may seem as though it's a sad situation, but we are fighting, and we believe that our continuous fight has helped in some way to mitigate the power of what kidney disease has been doing to this country of Belize.
But speaking now as putting on my nurse cap, it's not a quick and easy fix. It's something that would need commitment from the highest level, from the cabinet room. It's a strategy that would entail a long-term commitment to prevention of kidney disease, to healthy living. What we tend to do right now is this sporadic assistance, try to promote it in different areas, but it's really a long-term commitment and strategy that is needed to address the problem. If not, this will continue and it will get worse.
Yeah.
And so whatever little we can do.
Yeah. I wanted to ask, because I think right across Belize also has a very captive audience. You have, professional cyclists coming out to just professional people. How do you use the opportunity to also educate on the cause that you're supporting? For example, and I know the work of the Kidney Association is so important in assisting, but really the most important work is the prevention work, because while the dialysis saves lives, that's where we don't want people to get. We want them to understand that if you have diabetes, it has to be consistently managed, not today, tomorrow, and using pills. If I have hypertension, I'm sticking to my diet, maintaining my pressure. If I don't have any of those diseases, I'm doing what I need to do to prevent it, and drinking enough water and many different things that you have to do for your kidneys. But how do you use the opportunity with this very captive audience? You'll have media crews to remind people that we want to help people with dialysis, but we want people to understand we don't want to get there.
Well, we met with the president of the association before, when we decided that we would be donating to the Kidney Association. And just an example, we have branch offices across the country, and all of our branch offices has the screen. We offered to provide us with whatever information you have. We have people coming in. Most of the people that come into Social Security offices are claiming for some benefit or the other. Yeah. And those are the audiences that you want to capture. So that's one of the ways that we offer to help.
Okay.
The other ways would be by our fundraising efforts, because we provide information and awareness as well through those. Yeah. Coming on these shows and talking about it is another way. This year, the fundraising efforts are going to start with the ride. In previous years, they've ended with the ride. But this year, it's going to start with the ride. And so our fundraising efforts will start now, and they will continue probably until around October.
Okay.
And so we'll be engaging with the association in whatever way possible we can. To spread the word and to share the information.
So what's the most important message that you tell people in prevention?
We mostly talk about the people who are on having diabetes and hypertension, as those are the leading cause. Yeah. We have met a lot of people who have both diabetes and hypertension, which take them at a higher risk. As what you said earlier, one of the things that the Kidney Association is now doing, we are also embarking in screening. We're not only educating, but we also want to do a lot of screening, because what we find out is that when we do most of the health fair, whenever we do whenever we screen the patient, we always get them at end renal failure, and we want to catch them before. Yeah. One of the other situations that we're facing is that some of the people do yearly checkup, but some of them do not request getting kidney testing. And so we are trying to put that in place to where we ask people to try to test your kidney. And we are trying to advocate that the people who are suffering from diabetes and hypertension get tested every 6 months and check their kidney functions, so that they could keep a track on what's going on. We also have our nephrologist in here right now, Dr. Hyde. He's now working at Major and Roberts right now. He's seeing 60 patients within these 2 days. And then he'll be traveling to La Lumanus to see some more patients. Wow. In his clinic, he have met some patients, like yesterday, he had 17 in the morning and 14 in the afternoon. He also meets some patients who are already on dialysis, and he have met some who have not started dialysis yet, that we are trying to get to a level where they can get better, right? So that's what Kidney Association is now embarking on, in assisting. The screening process is what we want to push a lot.
So that you can catch it early.
Yes.
So it's not chronic where you have to live on dialysis.
Yes.
That's I mean on dialysis, sorry.
Yes.
What's the type of money that you're hoping to raise?
Well, we usually try to raise the minimum of $25,000, because the Social Security Board pledges to match dollar for dollar every up to $25,000.
Okay.
And so if you donate $1, it's matched by the Social Security Board. So that's usually the minimum that we try to raise. Of course, we've raised in excess of that as well, and it varies on a lot of things, and the economic situation of the country at the time, on the causes. People tend to gravitate a lot to this cause from what we have seen. And so we hope to raise 50,000 or above to give to the association.
With this
Yeah, it's
overwhelming issue, how do you manage the resources? $50,000 is a huge help, but how do you decide, okay, well, I'm going to discriminate? What do you focus on with that money to get the biggest bang?
We have spoken with Social Security, and where we will be embarking on having 50% of that be associated with education awareness, and the other 50% will be on paying for dialysis. So, and that's how we do our resources. It would be ideal for us to say 100% go on dialysis patients, but then again, the preventative part we will be missing. So, as a team, a very dynamic team, we meet frequently and decide on what we do on a frequent basis, so that we don't feel overwhelmed that we are not doing what we're supposed to do. But our key objective is prevention and assistance to kidney patients. And what we do most of all is fundraising, and one of our directors say, you guys have become a professional beggar. because that's the only way we're
You're begging
able,
on behalf of the people who can't go and do it on their own.
and we want to thank organizations who are willing to support us. We have organizations who have not come on board as yet, and we do understand. But those who have, we truly appreciate their support.
Could you talk to us about measuring progress? Because for me, if I were in there, I'd like to at least have maybe a Pyrrhic victory somewhere to be able to say, hang my hat to say, okay, well, we're making progress. How do you measure the progress that you're making as an association? And after getting this donation, hopefully it's 100,000.
We'll try as hard as we can.
What would you consider to be a marker forward, a progress from that money? Ideally.
We do several measures. Under the preventative care, we look at patients who are at risk and discover that they have symptoms of kidney disease, and then we put them in a program with Dr. Hyde, and that would allow them to slow down the process of kidney disease. So that is one area where we do.
And are the numbers decreasing over the years, you'd see?
Yes, the numbers are decreasing. Those that we are able to get to.
Yeah.
Because we have patients who are in the denial as well that would say, I want dead anyway. But we try our best to reach out to them. So that is one way in which we are able to measure that patient A, or these several patients who were at risk are now in a better position when it comes to their kidney functions and all that. We have patients who have been on the Dr. Hyde list for quite a number of years, who are happy to say, thank you so much for informing us and educating us about the kidney disease, because now we know what we need to do in order to prevent kidney disease. That's for one area. The area in assisting with dialysis, we're able to assist patients who have been on dialysis now for quite a long time. We have patients who comes critical to us. Those are our also patients who we would normally assist, but unfortunately they would pass away. So that's how we go about measuring our successes. Sometimes we are successful to a large extent, sometimes we're not, because we fight for some cases, and then after 2-3 years the patient would pass away. So that's how we go about
I would like to inject in that and in saying that some of the success stories that we look on is like our 17-year-old who is on dialysis and still going to school at St. John's College. We have many patients who have done a complete turnaround. The ones who, like Ms. Ruby mentioned, that we have caught early. So it's a great joy. One question you were asking about before, how do we cope?
Yes.
And one way of coping, I always do, is look at the positive stories that we have gotten and tell ourselves that, okay, we might have missed this, but what can we do to continue? And like myself and Oscar and the team have spoken, we want to do a lot of screening. So we're thanking Social Security because it's something that we wanted to do. But now that we have these funds, we can now go out and screen countrywide.
So you'll do what, kidney function test?
Yes, kidney function tests and screening countrywide. And that way, if we go out, when we go out and we start screening countrywide, we will get more people at an earlier stage that we could assist
And for people at home who go to the doctor for checkups, what do they need to ask for to test their kidney function?
I just wanted to add to what Ms. Genevieve is talking about. Part of our screening is your urinalysis. That's the first stage of what we have introduced, where the screening will be your urinalysis, because that tells more of a story than we would tend to believe. And once you are screened, that will tell you what risk you have. And then the next step would be to do your kidney function test, where you would take your blood test to test to see your kidney function level. And even with that, as what we constantly tell our those who visits us, we are not the doctors. We want to make that clear out there. We are here to help, to assist. We do the screening. We recommend that they do the blood works. We even go ahead and call the lab and say, we are going to cover X amount of patients. To test your blood works, and then from there visit your doctor. Or we schedule them in with Dr. Hyde. But your question was?
No, you already answered it in the type of test that people need. They could ask for a urinalysis or to get a blood test with kidney function. So Ruby and Genevieve have really highlighted why they are a deserving institution with the work that they do. Chandra, how do others play their part? How do they help right across Belize raise funds? It starts tomorrow.
It starts tomorrow. It starts tomorrow. We go from Corozal. We ride from Corozal to Belize. And then on Thursday, we ride from Belize City to Cayo with a stop in Belmopan. On Friday, we ride from Cayo to Dangriga, and then on Saturday, we ride from Dangriga to Punta Gorda. So all of that will include some awareness that will be taking place as we go along. If we get a little bit of the media coverage, then to spread the awareness. It's less about the ride now and more about the recipients. And so in order for the public to assist them, we're doing our part in fundraising at the Social Security offices. You probably will be hearing a little bit more about that. We have a golf ski trip planned for fundraising on the 14th of July. If anybody is interested, we have tickets. You can contact us through our Facebook page, and a nice catamaran, and the price is right. And we will be having other fundraisers like that as we go along. We are also doing the usual letters to the business community and asking for their support. We've gotten some positive results already, and so we'll be following up on those letters. And if you gave 200 last year and you can only give 50 this year, we are very grateful for anything that anybody can give, because it's really going to help our Belizean brothers and sisters.
And for people who want to jump into their own prevention and maybe is it a very grueling activity, you know?
No, it's not.
What kind of experience level do I need?
You can do it, Marlene.
No,
you just
not me
need a bike.
personally, like me who's watching.
No, it's a ride. It's not a race.
Yeah.
And we have a lot of professional cyclists and a lot of non-professional cyclists, because we don't ride at a very high pace. And the professional cyclists are always there to help along. If you can ride a few miles, if you want, you can ride the whole stage. You have the support of the police department every year for safety on the road. We have the ambulance in case, you know, you're fatigued.
Sounds like that happens a lot.
Safety first for the ride. We ask all the riders to wear a helmet. And so the ride itself is pretty safe, and it's not for only professionals. It's anybody who would
How
like to
and where do you
participate.
register?
You register, $25 is the registration fee, way less than it covers, because it covers breakfast in the morning, it covers gels, bars, unlimited hydration throughout the ride, mechanical assistance as well, and also lunch when you arrive at the destination. And so we start at the 6 o'clock, the respective Social Security offices. You register there. We have a team that's ready to give you your bands and all, whatever you're supposed to get at the beginning of the ride. And that's it. It's very easy to do.
Okay, and it starts tomorrow.
Starts tomorrow, yes.
All right, and how do people get in touch with the association if they want to reach out directly?
You can call the president directly, 615-7128. You can call the office, 615-6861. You can.
Where's the office located?
It's located at 9068 LaCroix Boulevard. That's behind the complex.
Yes.
Yeah.
Wow.
Yes.
All right.
Good
And we
neighborhood.
just wanted to say quickly thanks to the staff of the Social Security Board, because they're the ones who are behind this this ride. I'm the one who comes on the TV, but they're the ones who do all the work.
Yeah.
And thanks to my team at the corporate communication services.
Yeah.
I would also like to say quickly thanks to the Ordonez Bike Shop, because they're donating their time to provide assistance to the riders because of the cause of the that we are riding for, and Caribbean Tire, who always their pickup for servicing. And so just thanks to everyone, and we'll be saying an extra thank you at the end when we can give a comprehensive list of everybody who has donated.
All right.
And thanks to you all for facilitating us on short notice.
But we thank you for coming in this morning and telling us all about the ride. Again, it starts tomorrow. You can register on the day itself at 6 a.m. And of course, it goes towards a very worthy cause, the Kidney Association of Belize. We're going to go ahead now, though, and take our final break. And when we come back, we'll have our wrap-up. So stay tuned.